Hello and welcome to the Health Confidence Academy. I'm Dr. John Dygert. In this video, we'll be discussing screening recommendations for osteoporosis. Osteoporosis is a condition that weakens an individual's bone integrity. The word comes from two Greek roots, osteo, which means bone, and poro, which means porous. As the name would suggest, bone from a person with osteoporosis has less supporting structure, which means that the bone is weaker. The way healthy bone stays structurally sound is by constantly breaking itself down and constantly rebuilding the existing bone. This is performed by specialized cells called osteoclasts, which break down bone, and osteoblasts, which create new bone. The bone matrix is mineralized with calcium-based deposits to solidify the structure. Osteoporosis develops when bone is being broken down at a higher rate than it's being rebuilt. You don't feel osteoporosis happening. It's not painful in and of itself, and the shape and size of your bones doesn't change. Often, people only realize that they have osteoporosis after their bone has weakened to the point that they suffer a fracture. Risk factors for osteoporotic fractures include a history of hip fracture in one or both parents, excessive alcohol consumption, low body weight, and smoking. In addition, postmenopausal women are at higher risk because of a drop in estrogen levels, as estrogen inhibits bone breakdown. Long-term use of certain medications, especially corticosteroids, can also increase this risk. It's estimated that more than 12 million people in the United States suffer from osteoporosis. Hip fractures, which are actually femoral neck fractures, are the most serious of the fractures that result from this condition and can cause problems with ambulation and independence, chronic pain, and decreased quality of life. And 21 to 30% of patients who suffer a hip fracture die within a year. Fortunately, the condition is treatable. There are several medications available that can help restore the structural integrity of bone and prevent fractures. In addition, screening for the condition is possible so that measures can be taken before problems arise. The United States Preventive Services Task Force currently recommends that all females 65 and older should be screened for osteoporosis by bone density measurement. They also recommend screening for postmenopausal females younger than 65 who are at an increased risk for osteoporosis. Increased risk is determined by formal clinical risk assessment tools, which consider the risk factors that we just discussed. Of these tools, the ones that are most commonly used are the SCORE assessment and the FRAX assessment. Those links are provided below. Once it is determined that you're a candidate for screening, there are a few screening methods that could potentially be used. The most studied and the most commonly used is the centralized DEXA scan. DEXA stands for Dual Energy X-ray Absorptiometry, which is why we say DEXA. DEXA scans calculate your T-score, which is a measurement of the density of your bone. A T-score less than -2.5 is consistent with a diagnosis of osteoporosis. In their review of evidence, the task force determined that it was convincing that number one, screening can detect osteoporosis, and two, treatment of women with osteoporosis can provide at least a moderate benefit in preventing fractures, specifically the most dangerous hip fractures. The harms of screening, on the other hand, were found to be very small, essentially just the minor radiation exposure associated with the DEXA scans and cost. Other medical societies dedicated to the management of osteoporosis have similar recommendations for screening. The National Osteoporosis Foundation and the International Society for Clinical Densitometry recommend the same screenings as the task force for women, but additionally recommend screening for men 70 and older and men aged 50 to 69 if they have elevated risk. There are other measures that can be taken to prevent osteoporosis. For one, it's important to consume foods that are an adequate source of calcium and vitamin D, which are important for bone health. This mostly involves eating a diet that's high in fruits and vegetables. If you have a vitamin D deficiency, then supplementation may be required. In addition, avoiding smoking and abstaining from more than 2 to 3 alcoholic beverages per day also helps prevent risk. And lastly, regular exercise, especially weightlifting or resistance training, help to maintain strong, healthy bones. In conclusion, bone health is yet another important consideration in maintaining overall health. Keeping yourself healthy with diet, exercise, and avoidance of smoking and excessive alcohol are important in prevention. And for those for whom it's appropriate, undergoing screening and subsequent treatment also decreases the risk of fracture. So, keep yourself and those close to you upright and active. Please pass this video on to someone that you know and love and help promote healthy bones. This is the Health Confidence Academy. We'll see you next time.